Hi, I've got a cold, so my voice is a little deeper than normal. Sorry about that. Okay, this chapter focuses on methods for analyzing data from randomized trials when there are treatment dropouts. Conventional wisdom is that intent to treat analyses are the gold standard for such cases. I argue otherwise. The appropriate method of analysis in the presence of treatment dropouts depends on the questions you are trying to answer. For some questions, intent to treat analyses are appropriate, but for other questions, per protocol analyses are appropriate. Trialists distinguish between efficacy trials and effectiveness trials. An efficacy trial seeks to evaluate the extent to which an intervention works when it is adhered to per protocol. That is, when people complete the intervention in full as prescribed. An effectiveness trial, by contrast, seeks to evaluate the extent to which an intervention works in real-world settings where people may or may not fully adhere to the treatment protocol and where therapists or intervention implementers may or may not faithfully implement the intervention. Per protocol analyses are appropriate for efficacy trials, whereas intent to treat analyses are not. If I want to understand what makes an intervention efficacious by studying the mediators of efficacy in an RET, then the proper analytic strategy is per protocol in form. Applying intent to treat analyses can yield misleading conclusions. On the other hand, if I want to understand what makes an intervention effective by studying the mediators of effectiveness, the intent to treat is usually, but not always, appropriate. In this chapter, I discuss in depth the two different approaches to analyzing data from an RET that has treatment dropouts. There are many misconceptions about such analyses. I showed that the traditional approaches to per protocol and intent to treat analyses have potential pitfalls, and I discuss more modern methods of analysis that are more appropriate. These include, for per protocol analyses, such methods as the direct covariate approach, IPTW methods, complier average causal effect analysis, G estimation, and targeted maximum likelihood methods, among others. I describe weaknesses of many commonly employed methods for intent to treat analysis, and I discuss modern methods that better accomplish the task at hand. This chapter challenges much conventional wisdom. I hope you find some useful nuggets of knowledge in it. Thanks.